Now that we've kind of broken down the concept of how the breathing should happen, how should it happen? So I want to go through a couple of my favorite exercises, and I have a lot of exercises for breathing, okay? Because I find some people need a lot of different strategies to make something that, could be considered quite simple actually happen because of tightness, restriction, ingrained patterns from years. So sometimes it can take a lot of troubleshooting. But I want to share a couple of my favorites with you to help get you started down this road. So as I'm sure you probably figured out, air and pressure follow the path of least resistance. And you've probably figured that out, whether you know you've figured that out yet or not. Because you're probably like, Sarah, I can't breathe into my sides as well as I want to. I can't breathe into my back. It just doesn't want to go. And so you're probably figuring out that wherever your path of least resistance is, remember those joints that connect the ribs in the front and the back? If your joints are tight, your ribs aren't going to want to move out to the side. So this is going to become a restriction. So then what's going to happen? The air is either going to go up or it's going to go out into your belly. If your fascia is very weak and healing in the front, then you're going to have a lot of give in the front. That's going to be your path of least resistance. Let's say you're an excessive abdominal bracer. You tend to hold a lot of tension here and hold your belly in all the time. Your path of least resistance is probably going to be your shoulders. So you're going to be in a shallow breathing pattern. So what we have to do is look at these paths of least resistance and try to figure out how we can equal everything up so that breathing is not quite as hard to get that great 360 expansion, to massage our psoas, get our ribs moving, keep our spine mobile, and all those good things that need to happen. Okay, so first exercise I'd love to start with is just simply sideline breathing. You've probably seen this before, but there's a couple things I want to go over as far as troubleshooting that I enjoy pulling out with this exercise. So have something to rest your head on. This is always helpful. And then what I want you to do is curl into a ball, as much of a ball as you can get, because we want the spine in a bit of a C shape. All right, what's that going to do? All right, so remember how we talked about path of least resistance. Okay, so if we're in more of a C shape, all of a sudden it's a little harder to breathe into our belly here because it's all scrunched up. The other thing you can do is if you do have a diastasis or thin fascia or stretched out muscles from being more newly postpartum, you can take a pillow and you can kind of hug a pillow into your belly. That's going to create even more resistance. And then what I want you to do in this nice little C-shaped curve is I want you to inhale into your back. Let's just start getting that motion together. And then what we can work on is pushing your fingers out. So if you kind of lift your abs on the bottom a little bit, you can stick your fingers right underneath your ribcage. And you can inhale and push them out. That's going to help you feel that rib expansion. So I like to get people breathing down so that they're getting that diaphragm moving. I like them to feel some movement in the back so they're feeling their back expand. We create a little bit of path of least resistance. If you want, you can put a pillow underneath your side to hold it up even more. That's going to create some resistance there and help it go a little easier. All right, and then from there, what I want you to think about doing is rib mobility. Because remember, we want our ribs to move with our breath, right? We want it to move out to the side. So if you're on your side and you feel like, wow, my ribs just do not really move, one of the things that we can do is add a little bit of pressure on our exhale. So if we can get all the air out on our exhale, then we can get this great movement with the inhale. So we're going to break this down into two parts. The first one, you're going to give me a nice inhale. And then on the exhale, you're going to kind of follow your rib in very gently here. We're not breaking ribs, okay? But just very gently follow your rib in with a little bit of extra pressure from your hand. So inhale, exhale. And I find it really helpful to do like a ha breath where you're kind of throaty. This will help keep the abdominal wall relaxed. And then we'll get all that pressure and we'll get all the air out of the ribs, out of the bottom of the rib cage, okay? So we're going to fully empty this lung. So I want you just to for as long as you can until you feel like, okay, wow, I can't exhale anymore. You can give me a little cough at the end if you want to, so that we get all the air out. So this whole time as you exhale, you have been gently encouraging your ribs to come in and down. And then we can do this two different ways for inhale. And we have two different goals. One, we can let go, and we can focus on feeling that big fill during our inhale. And like, wow, we're going to get such a great inhale after such a great exhale. Or we can hold a little pressure, Keep the pressure down in the front and get a big stretch in the back for inhale. So you're going to get a nice big stretch in the back for that inhale. So two things that you can do, two different purposes. One, if your back is really, really, really tight, you can hold a little pressure here through the inhale, and you should be able to try it. See if you can feel that really big stretch. So join me here and try this. See if you can feel that really big stretch. So you can get that nice stretch, or you can just let go and feel that great side movement. So two things, try both of them, see which one feels better. But this is one of my first exercises that I really like to just set people up with, to say, all right, let's just get used to this idea. And for some reason, side lying is not very threatening. I've got a bunch of others for encouraging rib mobility, rib movement, getting all that air out, and all that good stuff. All right, but let's go ahead and move into number 2. So there's an exercise by the Posture Restoration Institute, which is just a full squat, which is how people like to sit, but I love it. It's one of my favorite exercises. But as we know, pressure follows the path of least resistance, right? So let's say I am a woman and I came in and maybe I had some tearing during delivery and my pelvic floor might be a little bit vulnerable to pressure down. But we want to get that breath going down, we want to get it moving, we want to get the rib cage moving. And so we think about doing a full squat to help with that mobility. So if I do a full squat here, it's going to help with expansion in the back of the diaphragm. That's the whole point, okay? So we're inhaling, expanding the back of the diaphragm. All right, now, when we think about that, we get that nice massage and that psoas. This is so great. But what if somebody's really tight? Right? What if somebody has got just a really stiff thoracic spine? What if their thoracic lumbar junction, that TL junction, is just so locked in that the thought of being able to expand back there just feels impossible for them? So I get them in this position and I'm like, inhale, they're like, I can't get any air and it feels so stuck, I don't have any mobility. And this is where I want you to check yourself right now. So go ahead and give me a nice little squat. Inhale into your hand on your back. How much movement can you get your spine to do? How much movement can you get in your QLs, your quadratus laborum muscles on either side? Breathe into those suckers. Can you get them to release and move? Can you get your back to release and move? So let's go back to that woman who's really tight. All right, so she's come in, she's very stiff. Mid-back just doesn't want to move. And you put her in a full squat like this and ask her to breathe, there's going to be a lot of pressure going down into her pelvic floor. And I've actually had patients where they've ended up making their prolapse worse because they inhale down a little too deeply because they're so stiff through their mid-back and everything is so locked down and their pelvic floor is not providing any resistance to that pressure. Okay, so for what I like to do with those people is I like to have them sit on something, a foam roller, a yoga block, even maybe a little higher stool if we're really worried about that vulnerability. And then I will actually have them guard or hold their pelvic floor just a little bit, just like a pinch of tension, so that we can really force it into the tightest spot. So we're going to take the path of most resistance, and that is where we're going to tackle. Okay, so just be careful with that. Now, the opposite can be true for somebody who has chronic pelvic floor tightness. All right, so if their pelvic floor tends to sit a little bit on the tight side, they're going to be inhaling and they're going to be like, I don't really feel a lot of give in my pelvic floor. They're not going to be showing you that fear of like, all right, I really don't feel safe inhaling down. It feels very vulnerable to me, or I feel like I'm going to leak. I've had some women that have leaked a little bit when they've done this full squat for the first time because they didn't realize how much pressure could go down to their pelvic floor. But if they tend to sit on more on the tight side, then you can use this inhale to help massage and release their pelvic floor muscles. So for them, our path of most resistance might actually be the pelvic floor. Right? So you don't want to like excessively bear down on your inhale and really like force it. But you know, sometimes if somebody's got a lot of tightness, forcing a little bit might be just what they need. And so you put them here and you say, I want you to focus on opening into your sits bones. And if I have somebody with a really tight back of their pelvic floor, like they've been dealing with maybe coccygeus, maybe obturator tightness, you know, the back of their pelvic floor feels pretty tight and deep in their pelvic bowl, I'll actually have them aim their air and pressure into those tight spots. And you might want to do that now. So put a hand down on your right side. See if you can inhale on that hand, put it on the left side. See if you can inhale into that hand. Now, see, could you feel the air and pressure go more into the back of your pelvic floor than the front, which can be a beautiful thing for releasing tightness. Okay, so this is one of my favorite exercises, and like with every exercise can meet people where they're at, different demands, different problems. We just have to make sure that we go about the cueing of the exercise slightly differently to help people with those different areas. Okay, so I hope you try both of those exercises. You can also hold on to something that doesn't move. So let me show you this really quick because this thing is not going anywhere. So you can hold on to something that doesn't move, and this is the PRI version where you can put a lot of pressure into your system, because if I'm really squishing my chest in now, so there's nowhere for the air and pressure to go except back here and down into my pelvic floor. So that is the advanced high pressure version of that exercise. All right, so give those a try and see if you can feel a little better, feel a little looser. See if your mid-back doesn't feel like it lets go a little bit. You get a little more expansion, and see if your psoas doesn't feel a little bit better when you stand up. So try that breathing, and then stand up and see what your hip flexors feel like. So I have a sneaking suspicion they're going to feel a little better. And if they don't, this is where all the troubleshooting comes in. If they don't, I have a sneaking suspicion that you set off that hip flexor anterior chain, and that when you were doing the full squat, if you check your ankles, you might have been holding tension in your ankles to hold a position. So let go of that tibialis anterior, that front shin muscle, and let go and relax in your hip flexor. So you don't want to hold any tension in here. You want to let this go. So that's troubleshooting. That's some of the things that I see go wrong is people hold excessive tension in different areas, and then they're like, oh, I stood up, I feel a little worse. Why didn't that work? I'm like, well, let's go through this little checklist and find out what we're doing wrong with the exercise. Okay, so there you go. Try those exercises, see what you think, see if you feel a little bit better, and see if we can't start getting some mobility and pressure spreading through our breath. And then in our next lecture, we're going to be jumping into the pelvic floor and are really going to get into some fun stuff.